It started with one migrant worker infected with COVID-19 on 8th of February 2020. Soon after, new clusters of infections at migrant worker dormitories across Singapore started appearing. The first order of business was to protect the wider community from widespread transmission from these clusters. Hence, the Joint Task Force Assurance set out to manage the infection risk and provide care for migrant workers in the dormitories. All hands were on deck when the Singapore Armed Forces activated the task force to look into worker dormitories' COVID-19 management issues. Within 48 hours, the SAF deployed officers as part of the forward assurance and support teams at several dormitories to provide basic healthcare and health screening.
And we sent in teams centered on the need to assuage and to reassure. So these teams comprise of MOM, MOH, SAF and police. They went in with no great care and concern for their own welfare, but they knew that if they didn't do this, things could get out of hand.
We realized that this is a mission to take against fear. We need to assure Singaporeans of their fear of a pandemic outbreak stemming out from the dormitories. We need to assure the workers that we are here to take care of their health and their well-being will be taken care of.
I think the operations was dynamic because there are competing demands. One was actually how to quickly deploy the fast teams on the ground at a particular point in time when we had to restrict the movement of the migrant workers in the dorms.
We strategize what is required, which pool of people is required to be swabbed so that they can be identified early and isolated. The second part of swab operations will be the massive one, where it consists of, usually we swab about 600 to 800 workers at one time over a short 2-hour period.
Given the mammoth task of swabbing comes the potential risk of infection for frontline personnel.
We understood that there were concerns when conducting all the swab tests in the dormitories. During swab tests, patients could breathe or cough out infectious droplets. That kind of sparked the idea of wanting to create a solution that will allow them to conduct the swab test in a very safe environment that's also comfortable so that it can sustain the long hours of operations. Hence, we developed the mobile swab station, where we had the idea of putting the swab booth into a mobile vehicle that will allow them to deploy faster to the ground and save a lot of the time for them in terms of setting up and tearing down the equipment. The MSS is integrated with a ventilation filtration system with a high-efficiency particulate air filter that filters particles before the air enters into the cabin. That is an example of how we can adapt and repurpose existing defense solutions.
The mobile express scanner, it uses optical character recognition to pick up pieces of data from the past. The main challenge for us was to deal with national level requirements on the personal data protection as well as cybersecurity requirements that we have to comply with. Our experience with working with all these external agencies were very positive because I think we all have a common mission.
Given the high volume of patients at the dormitories, the SAF mobilized many of their personnel for operations. The Army Medical Services was one such group under the Combat Service Support Task Force deployed to support the Singapore Ministry of Manpower and the Ministry of Health in providing basic health screening, consultation services, as well as swabbing for migrant workers.
Three objectives. The first one is to make sure that we look after the migrant workers, especially in a dormitory. Two is to increase productivity of my people on the ground running operations. And the third one is to better protect them against COVID-19.
Given that the rate of infection was high within the dormitories, it was critical to separate those infected from those who were healthy. Part of the challenge was to identify asymptomatic carriers of COVID-19, and swab testing alone wasn't enough. It required serology tests to identify more information. This provides clues as to how many other people the patient might have passed on the virus to.
Swab testing itself is a direct test of the person's current status. Whereas from your serology testing, you can actually try and find out other information, like whether or not he was previously infected and all that. So it gives us information as to whether or not you have a higher chance of things like immunity, whether or not you've had previous exposures as well.
Migrant workers who were not infected with COVID-19 had to be decanted out of the dorms in order to stop the spread of COVID-19. Hence, the need to temporarily house these workers was crucial. During the circuit breaker period, the SAF swiftly converted Jurong Camp 2 and Bedok Camp 2 in support of the Ministry of National Development's request for urgent housing facilities.
The mission then was to prepare to take in foreign workers who were part of the essential workforce. So we were going to move them out from their dorms and they could continue going to work from our camps. At its peak, we had probably about 1,250 migrant workers staying in Jurong Camp and they were going to work. And then shortly, a few days after that, Bedok Camp was ready and we also started taking in migrant workers to house them. We were running 2 camps. There were probably about 1,700 workers going to work.
Additionally, daily meals and essential items were provided to ensure the patient's basic needs were looked after. On the ground, FAST members assist in the daily operations to care for the patients.
So the usual day would be, in the morning we would ensure that these foreign employees have their meals delivered to them. In a normal day today, we also have meetings between MOM and SAF where we have meetings on any outstanding issues from yesterday. We would also have meetings in relation to what we plan to do for the day, such as any new cases, any employees who are not feeling well that day, what are some of the procedures. We will remind each other of these procedures.
Our main role was to provide assurance, demonstrate care, and to ensure the well-being of the workers in the dormitories. This was done through allowing access to medical care, distribution of food, and to look into issues such as welfare and employment for these workers. From our frontline policing and community engagement programs, we have worked with dormitory managers. Essentially, our role was to be the liaison between the HQ planning team and the FAST teams on the ground. In order to support the FAST teams, it was important that we get the information quickly and accurately as possible so that the FAST teams could carry on the operations seamlessly. Working with SAF during this ops certainly has been a positive experience. There was a quick reaction and turnaround for questions, queries about what was required, personnel needed. They certainly have given me a lot of support in that area.
Despite the risks that come with working in the front line, many took the challenges head-on.
There are times when the hours are long and I feel quite tired and strenuous by the amount of work we have to do. But this is when I start to recall the purpose as to why I extended my ORD in the first place to help out with this COVID-19 fight. So I do not only want to contribute to Singapore's defense, I also want to help out in a role where I can help to ensure that Singapore can continue its normalcy.
I actually went out of my way during my off-duty hours to go to the supermarket and buy lots of groceries for them. I get nothing in return. But when they come and say thank you to me, when they come and receive the things from me, the smile that they have on their faces is actually enough for me, to want to do this again for them.
Thank you Singapore and Singapore people.
அவருங்களை எல்லாருமே இந்த மாதிரி எல்லாருமே பார்த்துக்கிறாங்க. அவங்களுக்கு எல்லாருக்கும் சிங்கப்பூர் அரசாங்க ஊழியர்கள் எங்களை பார்த்துக்கிறவங்க.
আমি সিঙ্গাপুর গভর্নমেন্টকে অনেক অনেক ধন্যবাদ জানাই যে আমি ফরেনার ওয়ার্কার হিসেবে আমাকে অনেক টেক কেয়ার করছে.
Caring for our migrant workers was an experience that taught many of us to appreciate the sacrifices they have made for Singapore. Despite the risks, heat, and long hours, every personnel had brought something special to this fight, no matter how small.
We were planning for the operations during Ramadan. It's a time for us to break fast together, and obviously this was not possible. We were quite set on wanting to make sure that the support was still available for them. You're looking at more than 200,000 meals to delivered, at 3-4 a.m. in the morning, and then quite consistently at about 5 to 6 p.m. before the breakfast meal.
It's 4 months of being in the dormitory inside their own rooms. So definitely there was this sense of resentment and restlessness.
We do owe much of the success and the prosperity of Singapore now to the migrant workers who built the nation. So I think it is timely for us to contribute back to them, to help them through this crisis and to safeguard their well-being.